Alright. So, tapos na tayo sa brief review ng mga precautions, contraindications, special considerations, and overall overall function ng mga patients natin with cancer. I hope na natutunan natin or naging mas clear sa atin kung ano ba yung function nung in-expect ko na meron yung mga patient na bibigyan kong treatment. So, that's for the first part. Ngayon namang second part natin, it's primarily identifying kung ano ba yung magiging plan of care ko na considering na ganun yung mga treatment na yung mga symptoms na meron yung patient. So, as you know, our college wants us to be evidence-based. So, ang gusto kong i-instill sa atin ay lahat ng mga physical symptoms na naisip ninyo na pwedeng na natutunan nyo sa therapeutic exercises before, resistance, aerobic, kung meron siyang pain, bigyan natin ng pain management. It applies pa din. Pero, hindi lahat magiging effective at applicable para sa lahat ng patient. Kadalasan, for example, yung konting ROM exercises, resistance na yon para sa patient. Konting aerobic exercises na walking, functional training, aerobic conditioning na yon, for example. So, for the next part, hindi tayo mag-focus kung ano ba talaga yung management, ano yung gagawin ko, una, pangalawa, pangatlo. Kasi supposedly, you can critically think kung ano na ba yung magiging appropriate sa kanila. Ang gagawin natin, meron tayong certain strategies, resistance, aerobic, massage, TENS, bandaging. Meron tayong certain specific PT strategy. Sabihin natin kung ano yung evidence-based at effective ba tong mga management para ma-alleviate mga symptoms na nasabi natin. Alright? So, for this section, what we're gonna try to do is to answer what we can do to help and what does the research say. So, this is EBPT management for patients with cancer. So, primarily, the evidence says, based on Vera, Moller, Verdi, Kang, and Fuller, primarily, ang meron tayong research na effective ay research about resistance training, aerobic conditioning, massage, relaxation techniques, compression bandaging, compressive garments, and lymphedema management, which is usual for patients with cancer, and the usage of TENS. Hindi ang mga mabibigay natin sa patient, pwedeng hindi lang ito. Maaring, kunyari, meron kayong neurologic overlay, so meron din kayong konting neuron na ibibigay. Pero kadalasan, ito yung mga strict patients with cancer na special para sa kanila yung mga management. So, bakit naging special sa kanila? Kasi yung mga patients na ginamit sa mga different researches na to, meron lang silang cancer na wala masyado ng mga other overlays. So, kapag ganun, ang treatment management natin is treat them as neurologic case. Merong cardiac dysfunction, treat them as cardiac case. Merong pulmonary dysfunction, hindi siya makahinga, meron siyang intubated, treat them as pulmonary disorder. Right? Ngayon, strict na merong cancer yung patient mo, pwedeng meron or walang comorbidities or neurological overlays. And kadalasan lahat ng mga patient na to, palliative, hospice, end of life. Okay? So, sana clear yung ating kung saan natin tumakap. So, ang management na meron tayong research about is resistance, aerobic, massage, relaxation, bandaging, lymphedema. Alright. For the first one, it's resistance training. It's been known to improve fatigue, QOL, and lessen pain. Meron tayong moderate effect sizes based on Hilfiger, pero based on Vera, meron tayong mga other studies na meron little to no change in fatigue status yung resistance training. Kadalasan kailangan natin yung resistance in conjunction with aerobic exercise para meron tayong magandang effect. Based on a meta-analysis, however, ni Nakano, nakita natin na effective at merong moderate effect yung resistance training. Ang main problem lang sa research base natin, different cancer types kasi. And we know na based on specific cancer type, meron silang predilection on the type of physical symptom na meron sila. So, ang takeaway natin, resistance training, medyo dubious sa iba, pero overall, it can improve fatigue, quality of life, pain. For some, yung iba kasi medyo generalized yung kanilang pagsabi na pag mag-exercise ka, resistance exercise, gagaling ka na sa ibang physical symptom mo. We know na walang effect ang resistance training sa kanilang GI problems, sa pag-feel nila or tolerance nila sa nausea, the loss of appetite nila, and kadalasan for prolonging their life. So, wala tayong study or no evidence for. Ngayon, kapag magbibigay tayo ng any type of resistance training, ang may evidence tayo ay at least twice a week. So, meron tayong small to moderate amounts of improvement. Kapag inpatient, kadalasan 3 to 5 times dapat. Meron tayong other studies na nagsabi ng up until 6 times. Intensity natin would be about 60 to 80% RM. Ngayon, ang caveat natin dyan, applicable lang to sa mga patients na walang risk sa cancer-induced fractures. Of course, for that specific segment, kapag meron siyang risk for metastatic fracture, hindi natin ito maaabot dahil mataas yung risk. Ngayon, sabihin na natin na talagang isolated muscle groups, yung 60 to 80% RM yung pwede natin gawin. So, ang time natin or frequency ng ginagawa or kailan yung timing, pwede natin siyang gawin habang nagki-chemo phase, hindi during the day na nag-chemo, pero habang yung weeks na nag-chemo siya. After ng surgery, pwede mo rin siyang gawin inpatient or outpatient, effective siya para sa mga patients. And yung types na merong specific evidence for is the use of resistance bands and functional training using body weight. Kadalasan, very light lang yung resistance bands and hindi tayo masyado nag-opt ng mga heavyweight dumbbells dahil sa risk na pinupost ng during treatment itself. Alright. For now naman, aerobic conditioning. Aerobic conditioning can be effective for patients with a cancer with moderate effect sizes. It can be beneficial for fatigue, dyspnea, and insomnia. However, based on Vera, pwede siyang mag-improve ng quality of life pero little to no effect on fatigue. But, narrative review lang kasi yung review niya. So, medyo mas paniniwalaan natin si Nakano et al. Na meta-analysis. At sabi doon, meron siyang good effects for fatigue, dyspnea, and insomnia. Ngayon, ang fit natin doon, it's at least same pa rin, parehas sa resistance training. At least twice a week, 3 to 5 times, pwedeng 6 times for inpatient rehab. And best ay Borg scale. Yun ang best na gamitin natin for intensity. Lalo na kapag meron cardiovascular depressant drugs. Pero pwede natin gamitin ay 60% ng 80%, 60 to 80% ang maximum heart rate. Ngayon kapag very light activity, limit yourself with about 20 beats per minute na increase sa resting heart rate niya at the time of um, assessing vital signs. Ngayon, same pa rin. Pwede mo rin siyang gawin habang nagki-chemo phase yung patient mo after ng surgery. And inpatient, outpatient, known na effective siya. Ngayon, ang type natin na pwedeng gamitin ay stationary cycling and then treadmill. Yung iba, gusto nila ng underwater para ngayon less load kasi nga at risk sa infection yun. Kaya hindi natin in-opt na mag-swimming. Pero yung iba na meron ng medyo mas mataas na tolerance at hindi immunocompromised, other studies nagse-search na nagsiswim pa rin sila. Right? Pero ang gusto natin stationary cycling, treadmill, other exercises like ergometer, for example. Alright. For massage, wag kayong magulat na, sir, ba't meron tayong massage? Hindi naman tayo masahista. Yes, hindi talaga tayo masahista, pero meron tayong capability na magbigay ng therapeutic massage like effleurage, petrissage, and deep friction massages for myofascial releases. Pwede pa rin natin yung gawin. However, meron din naman tayong licensed massage therapists na nagsispecialize for end-of-life care and cancer treatment. Pwede mo silang i-refer doon. Kasi, ba't mo gagawin yon? Dahil may good effect siya on anxiety. Short term lang, pero for long term, walang masyadong evidence for the research base. Maganda pa rin siyang magawa kasi kadalasan sobrang sakit nung cancer pain at non-specific siya, as you know. Dahil doon, pwedeng mangyari ay yung mga overlay na muscular problems like nodules and tight muscles and very stiff na at nagsispasm ng mga back, pwede mo i-release yun. Mag-improve yung pain niya, at least yung cancer pain na lang yung ma-feel niya. And yung overall quality of life because of the less pain na feel ng patient. Pero more than that, ang pinakamahalaga doon, pwede siya mag-decrease ng opioid use. So, gagawin mo siya kasi mas less yung morphine na may intake niya. Kapag ganon, mas better para sa health ng patient na. Alright. So, ang frequency natin is 30 minutes, about 3 to 5 times a week. At least 3 weeks mo siyang dapat gawin para merong effect. Ang intensity natin depende sa patient kung kaya niya yung position na kinakailangan para makapag-massage ka. The time during chemo and post-surgery, pwede mo siyang gawin inpatient or outpatient. Same rin lang dun sa kanina. At ang type ng gagawin mong massage, MFR, effleurage, petrissage, back massage, and aromatherapy. Ngayon, sasabihin nila na, ay sir, hindi namin sure kung ano ba type talaga ng massage yung applicable para dun sa patient. Actually, ang pwede nating gawin ay kahit ano. Walang isang massage na pinaka-effective. At it's found out na yung mga nagsabi, ay, aromatherapy yung best. Same lang yung mga MFR and other massages with aromatherapy in terms of the outcome measure. So, do any massage para sa patient. Alright, so kadalasan kasi ayaw natin medyo as PTs, ayaw natin yung massages kasi medyo tabu yun sa atin na, uy, masahista ka, ano, kasi hinihilot mo yung patient o may cancer. Actually, those are better kaysa naman yung usual na gagawin natin kapag merong anxiety yung patient, magbigay ng relaxation and breathing techniques. Kasi generally, wala siyang clear benefit on anxiety, insomnia, and other quality of life skills. Kaya ngayon, para magkaroon ng better alternative, gawin mo na lang yung massage, pero kung ayaw mo talaga, i-refer mo sa massage therapist, or ang best alternative natin is refer mo sa counseling and psychology. So, out of our scope na ito, pero it's a good FYI na yung logotherapy by Viktor Frankl, so the meaning of life, logotherapy, maganda yon for their anxiety and depression. CBT, or cognitive behavioral therapy, a very effective use for anxiety and depression. And then group sessions, music therapy, and yoga, lahat yon ay may clear benefits ng small to moderate effect sizes on quality of life, anxiety, emotional, spiritual, and mental well-being. So kung hindi man ikaw yung makapagbigay ng breathing techniques, ma-refer mo to sa kanila, immediately yung quality of life nila mag-improve. Alright. So, a common sequelae of any type of resection ng cancer ay lymphedema. Dahil alam natin na travel yung cancer sa parts ng body through the bloodstream and the lymph nodes. Kapag nag-resect doon, magkakaroon ng blockage, may lymphedema, mag-i-edema yung patient. Ang pinaka may evidence would be based on Gradalski's research about complex decongestive therapy. So specifically, yung short stretch compression bandaging o yung bandaging na naituro sa inyo for lymphedema management, effective siya. Pero on its own, hindi siya effective. Kailangan mo siya ng gamot, pharmacotherapy, kailangan mo siya ng exercise, kailangan mo rin siya ng bandaging. So lahat yun. Ngayon, dapat ginagawa mo siya for about an hour, 4 to 5 times a week. At least 3 weeks para meron kang makitang effect. Pero up until 4 to 5 to 6 weeks on other researches. Ang intensity natin, it's about 16 minutes mong gagawin or until the edema resolves. Kadalasan, kapag 16 minutes mo nang ginagawa, minimal yung edema na nawawala, you stop there. Pero kadalasan, in about 30 minutes, meron ka na magiging significant improvement for the edema. So, ang timing natin, kahit kailan pa rin, kadalasan ginagawa na to outpatient basis. Kasi after the surgery, hindi mo pa makikita yung lymphedema, lalabas na lang siya after. So, ang type natin, pwede ka magpa-CDT, mag-bandaging, and or mag-intermittent pneumatic compressions. So, meron tayong device na para siyang malaking boot at any part ng body, pwede mo siyang isuot. May fit para sa kamay at sa paa. Meron lang specific setting and then magpa-pump siya ng air depending on the type of pneumatic compression na gusto mong gawin. At unti-unti, magde-drain yung area na yun. Ngayon, medyo mahal kasi yung jobs na yon, about 200K, at hindi lahat ng clinic meron nun. We have had patients doon sa PGH, pero medyo mahal din kasi siya. Kaya ngayon, as PTs, kung wala man tayo na, pwede tayo magpa-complex decongestive therapy. Now, yung mga next slides natin, pwede nyong i-view kapag nasa inyo na lang, pero papakita ko lang yung video natin about the specific exercises na ginagawa sa complex decongestive therapy. So, basically, pwede nyo ma-search yun, pero basically, ang CDT, lagyan ng bandaging, turuan sila paano mag-bandage, mag-self-care, i-check lagi yung skin, bigyan ng time frame kung kailan tatanggalin yung bandages, and then mag-exercise habang nakabandage. Plus, mag-manage ng gamot. So, ito yung mga exercises na for CBT.
Before we start doing the movements, we need to do some deep breathing. One, two, 3. Before we start doing
Alright? Medyo ni-next ko na siya, no? Pero, medyo nagsistutter kasi dito. Bibigyan ko naman kayo ng PowerPoint. So, I hope you watch the PowerPoint na lang. Pero, ikwento ko na lang kung ano yung nandun dun sa video. Mga specific exercises like deep breathing, ROM exercises, shoulder stretches, tricep squeezes, arm lifting, leg lifting, yun yung mga ginagawa doon. And yun yung specific exercise for lymphedema. Also, huwag niyong kalimutan yung sa Kissner, lahat ng mga rolling, yung mga ganun, nakahiga, stretch, nakataas, no? Lahat yon effective for patients with lymphedema. Okay, so now we go to TENS. So, TENS ang nag-iisang pain modality na merong evidence na positively effect ng less opioid use and less cancer pain. So, it's based on a good, an acceptable RCT by Siemens et al. Noong 2020. So, ano ba yung types na meron tayo? Meron tayong intensity modulated TENS. Yan, nandiyan yung kung paano siya ginagawa. Pero primarily, ano siya iniiwasan lang niya yung pag-attenuate. Iniiwasan lang niya pag-habituate. Para ngayon, ma-feel ng patient yung TENS at every time. So, mataas muna and then unti-unti bababa. Ang problema dyan, medyo mahihirap yan kasi depende dun sa TENS na gamit mo. Kaya ngayon, pwede mo rin gamitin yung TENS na normal. Ngayon, ang study na yan, kaya mo gagawin, ay primarily dahil ang study is about, meron ba difference kung gawin ko yung intensity modulated versus yung normal TENS? The answer is wala naman masyado. Mas preferred lang ng mga patient yung intensity modulated kasi mas matagal nilang nafe-feel yung sensation ng TENS. Kesa naman, yung TENS na matagal lang, nagkakaroon ng habituation. Yun lang yung main na difference. Pero in effect, walang superior towards each other. So, anong take home? Mag-TENS, normal man or hindi. Pero kung pipili, mag-intensity modulated TENS. Okay? So, use TENS for less opioid use IMT.